The reason for coronavirus is called by this name. Coronavirus belongs to the group of viruses that possess RNA viruses, and the reason for coronaviruses is called by this name because they have something similar to the aura or crown. The surface or envelope of the virus, as these viruses are distinguished by having the largest genetic group among RNA viruses known to date, and a high ability to collect genetic information from various sources. Coronaviruses are widespread, as they are considered the second cause of cold after nasal viruses rhinoviruses, as coronaviruses cause diseases in many animals such as hepatitis in rats, inflammation of the digestive system in pigs, and respiratory infections in birds. 1. The first coronavirus was isolated in 1937, and it was a virus that infects chickens with bronchitis. Since then many coronaviruses have been found that infect animals such as cattle, horses, cats, dogs, and mice. In 1960, the first human coronavirus was isolated from the noses of patients with a cold. OC43 and 229E are the most common coronavirus caused by humans. There are other types that may be more dangerous. Take a look at human life. 1-2 If you are looking for a new coronavirus in China, read the following article, The Reality of a New Coronavirus Outbreak in China. These symptoms last for several days, including the following: 2-3 runny nose and sneezing. Feeling tired and tired. Suffering from headaches. Coughing or coughing. Incidence of fever in rare cases. Feeling pain in the throat. Exacerbation of asthma in those with it. In addition, the coronavirus can affect the lower respiratory tract and infect it. Examples include pneumonia and bronchitis, and these conditions are more common among heart and lung patients, weak immune patients, infants, the elderly, and due to the difficulty of cultivating coronaviruses. In comparison with the rest of the other common cold viruses, it is difficult to judge the extent of their effect on the health of society in general, as the ordinary person cannot know whether the cold has been caused by coronaviruses or other cold viruses, but this does not change the way of treatment, and symptoms end the disease, however, usually after several days. 2-3 Types of coronaviruses differ in the types of coronaviruses that infect humans in their ability to spread and transmit infection, and in the severity of the symptoms that cause them. It is worth noting that it can divide the coronaviruses that infect humans known to date. It has 6 types. 2-4 The most common types: 229E virus, NL63 virus, OC43 virus, HKU1 virus. Less common types: MERS-CoV virus, the virus that causes Middle East respiratory syndrome, which is considered to be 30 to 40% fatal for people with it. The first case was diagnosed in the Kingdom of Saudi Arabia in 2012, and since then it has been infected with this. The virus has many people around the world, and most of the cases were in Arab countries located in or near the Arabian Peninsula, but the largest outbreak of the virus outside the Arabian Peninsula was in South Korea in 2015, and symptoms of the disease include fever, difficulty breathing, coughing or coughing. 4-2 SARS-CoV, it is the virus that causes the virus severe acute respiratory syndrome, is known as SARS, where the disease was first discovered in China in November 2002 and then spread globally in 2003 AD. In the period between 2002 to 2003 AD, 8,098 cases were recorded. With SARS, it resulted in the death of 774 people, and this virus leads to acute and life-threatening pneumonia and is characterized by its ability to infect the upper and lower respiratory tract. It can also cause gastroenteritis, as symptoms of the disease appear within a week, gradually starting with fever and then similar to colds such as dry cough, chills, shortness of breath, feeling pain, and later the disease can develop into acute pneumonia, and in more advanced stages it may cause lung, heart, or liver impairment. 2-4 Coronavirus transmission. Coronaviruses may be transmitted from person to person in any of the following ways. 2-5 Moving through the air through coughing and sneezing, especially if the mouth is not covered by the affected person. Direct contact with the patient by touch or handshake. Touching surfaces contaminated with the virus and then touching the mouth, nose, or eyes, without washing hands. A fecal transfer is rare.